What do you find most intriguing about the world of skin health right now?
Social media and what it's done. I mean, we live in such a appearance-forward world.
How do you see the trends that you noticed 10 years ago, let's say, evolve? You know, we're moving away from just Botox, right?
Yeah, mass beauty is a thing. L'Oreal, Shiseido's of the world, right, have made mass beauty accessible, and it's been part of everybody's culture.
What was your driving motivation? So I think really getting back to basics, having people understand the different categories is just as important as them going different providers, which you're also vetting.
We'd like to make skin regimen very similar to your workout and your eating habits. You should be able to hear from a dermatologist, but as you move countries, states, cities, jobs, whatnot, it'd be great for every consumer to walk around with their skin thumbprint in their hand, that they could go to their doctor and say, you know, I did get filler. Maybe that's why I have this blue line under my, but your skin changes over time.
We were in such a great time to be alive because like we have all this science and then like we have the industries that help sort of like create this science and make it accessible. I think we're in a major point in time, but it's also important that we cut through a lot of the BS that's out there. I'm Dr. Anthony Rossi, and this is Give Good Face, a podcast focusing on skincare science, and how to maintain and shape a healthy lifestyle. This podcast is brought to you by Joya, the first and only preventative skin health employer-offered benefit, dedicated to saving lives and changing the way you look and feel in your own skin by offering access to education and accredited providers, all at an affordable cost. Learn how you can bring the joy of healthy skin to your employer by visiting www.joyahealth.com. I'm super excited to have here Michael Jafar, founder and CEO of Joya, the first preventative skin health benefit platform for employees. With over 20 years of experience in healthcare and medical aesthetics, he has held C-level executive positions and played a pivotal role in launching or scaling iconic products like Juvederm Voluma, Cool Sculpting, Skin Medica, Latisse, Botox, and Jeuveau. Prior to Joya, Michael led initiatives at Allergan, Evolus, and Desktop Health, driving innovation in aesthetics and healthcare technology. He holds an MBA from USC Marshall School of Business and a BA in International Business from the University of San Diego, using his deep expertise to revolutionize employee skin health benefits. Hi, Michael. How are you today? It's so good to see you.
Likewise, good to be here.
Michael's my good friend. We've known each other for a long time now, both in the beauty world, medical, and you have a really interesting background and interesting history. And I want to take a deep dive with you in all that, including Joya, which is like super exciting. And I want you to tell us all about it.
Yeah, excited to be here. It's been fun seeing this space evolve over the last couple decades together. So thanks for having me.
What do you find most intriguing about the world of skin health right now?
You know, skin being your largest organ, I think it's finally becoming a thing, right?
Yeah.
It used to be more of a passive area of focus. Consumers at different age groups treated their skin differently, right? You had the millennials kind of redefine how engaging we should be with our skin. And I'd say a big driver of that has been the Kardashian effect, has been, right?
Yeah.
Social media and what it's done. I mean, we live in such a appearance-forward world. I mean, we're on a podcast. Most people would do this podcast through an audio, lens, but now there's a video and an audio component to everything. So I'd say that background is driving a difference in how we approach skin. And let's not forget hair, right?
Yeah, for sure.
So I'd lump skin and hair as being one of the biggest kind of segments in what I see. McKinsey did a study in 2023, and they surveyed over 2,300 consumers.
Nice.
And they broke them up by age groups, Gen Zs, millennials, boomers. And they found that Gen Zs and millennials spend more on their cosmetic procedures, their hair care, and their skin care than they do on health, on fitness, on mindfulness, even their pets. So they were looking at where the corporate spend is going, and appearance was by far the largest category of spend. So not surprised, but I do see this as a thing nowadays, right? As skin being your largest organ.
Yeah. So we met when I'm a dermatologist and you were at Allergan, which is a huge company that focused on the beauty space being Botox, their number one, cosmetic brand. And things have changed much drastically since
Yeah.
then, right? So things have evolved. You have this unique perspective, right? Being in industry and now more so in this entrepreneurial startup role. How do you see the trends that you noticed 10 years ago, let's say, evolve in that, we're moving away from just Botox, right?
Yeah. Great question. And it's been fun to see our careers kind of start at the same point, but from two different lenses.
Totally.
Right? You saw it from a practitioner standpoint as a thriving, evolving dermatologist that's become world renowned, right? And I got to see it from an industry. And luckily enough, I got into this industry time where this was just starting to become a thing. But if you were to step back, everyone has known about mass beauty, right? Mass beauty is a thing. L'Oreal, Shiseido's of the world, right, have made mass beauty accessible. And it's been part of everybody's culture. Makeup, hair has been normal. Then the evolution over the decades went from mass beauty to prestige beauty, right? Mm-hmm. Even companies like L'Oreal had SkinCeutical, right? Allergan had Skin Medica. Your skincare line would be considered prestige, right? So that prestige category is much better ingredients, right? Medical grade ingredients, more effective product, more expensive. And most of them have been only accessible by a smaller kind of channel, being dermatologists, plastic surgeons, or med spas. What Allergan has done with Botox and Juvederm and everything else that they brought forward is that they've created this kind of third category, this medical aesthetics category against FDA-approved products that have profound impact. Some are instant, right? Like a filler. And that third category, I think, has taken some time to evolve, but has become one of the most impactful categories of our time. So that shift of consumers' willingness to enter that third category, I'd say has trended down in terms of age, right? You have people in their 20s asking about preventative Botox.
For sure, yeah.
Right? You have people in their 20s trying to avoid a nose job and use a filler for a nose, kind of an ideal nose shape. That category is one of the fastest growing categories against all three of these things. And I suspect that over time, it would be probably one of the largest categories in terms of dollars and in terms of accessibility. Within that, what has shifted is 10 years ago, you would be hard pressed to walk down the street, whether you're in New York, Dallas, wherever you might be, and run into a skin provider, right?
Yeah.
But now you have a med spa popping up nearly on every corner, right? There are 40,000 practices in America that will conduct procedures like Botox. Fun fact, there's about 12,000 Starbucks in America.
It's a good comparison.
It is, but that wasn't the case 10, 15 years ago. And I think the accessibility of this category has made it a lot more appealing to consumers.
Yeah, I mean, we can't underestimate the Kardashian effect either of just putting it out there, people understanding that these procedures exist.
Yeah.
Allergan has done a great job of bringing it to market and bringing FDA-approved trials to market, which is awesome. But I do think there is a responsibility, right, that we have to own up to and do these procedures correctly and in the right demographics. And
right.
You talk about the shift downward to Gen Z, millennials, and we want to serve them well. And I think Joya is such an interesting company, right?
Yeah.
It's amazing because you're the first employee wellness focused towards skin health and what that means. And, as a practicing dermatologist, and I'm part of Joya, just so the audience knows, we're really trying to make dermatology accessible for people, right? Because it's not only about just aesthetics and beauty, but also skin cancer and skin aging and skin health. So what was your driving motivation for that?
First of all, thank you for being part of that journey. It's been a fun 2 years with you as our medical advisor. And I think as a Mohs surgeon, as well as an aesthetic provider, right? I mean, you're a dermatologist that touches both sides of this.
Yeah.
You truly see the impact of your skin against your health and your mood and your confidence, right? You're not a one-track kind of mindset, right? So we appreciate the opportunity to sponsor this podcast as well.
Yeah.
For Joya, the reason why we wanted to be a health and wellness company pertaining to your skin is because there's another trend that a lot of people don't talk about, but they hear, which is everyone hears about, yes, I got Botox and I'm doing Botox and I look great and I feel good. Like everybody hears it. Like you'd be hard pressed to run into someone that doesn't do something against their skin, whether it's Fraxel or Botox or whatever you call it, right? But what people don't really talk about is the trend in skin cancer, right? if you look at just in the last 5 years, the cases of melanoma have doubled, right? And we're projecting to double again in the next 5 years. About 25% of Americans will get skin cancer at some point in their life. It's not a matter of can you avoid it. It's a matter of when am I going to get it, right? You live this world. Now, what are we doing at Joya, right? First and foremost, you take corporate benefits and you realize that since 98% or 97% of Americans have a job, right?
So like corporate benefits like dental or like
Vision,
pet insurance?
That's right.
Yeah,
that's right. Vision, dental, fertility, pet insurance. And you look at that world and you realize that consumers look to their employers to constantly innovate their world of benefits. It's an attraction point for employers. It's a retention point for employers. And because of the scale of the employers, they're able to drive costs of healthcare down, right, to the employee. Where if you're out to shop for something on the public market, you're likely to pay a higher price point than if you were to go through some group purchasing organization like an employer. So as I was looking at the offering, you have health, you have dental, you have vision, you have fertility, you have critical illness, you have pet insurance. But as I said at the beginning, skin is your largest organ.
Yeah.
So it always made me wonder, like, why is skin not a benefit on its own?
I agree.
Right? And as a dermatologist, right?
I think it's our largest benefit.
Now, you get some coverage from your medical insurance.
Of course.
But to get into your practice takes a couple months. And then when I get there, you're likely to tell me this is covered and this is not covered, right? Because again, you see the world from health and the beauty side. So we want it to be that supplemental benefit where we could help bridge the gap between what your medical insurance does not cover and what we're able to provide subsidy against. And then we wanted to find a way to help with the skin cancer diagnosis. Because if you could see it early, you could potentially prevent it from developing, right? And I think you've taught me this. You said that there's a 99% survival rate, right, if treated early.
For sure.
So what Joya is, it's a health and wellness platform focused against your skin, right? And we offer skin cancer checks at all of our offices. And that skin cancer check, which is conducted annually, unlocks your wellness or your beauty or your anti-aging benefits, right? Some people care about hair thinning and hair loss. Preventative aging is a big deal, right? So there's dollars on your digital wallet that you download through Joya. And you take those dollars at any one of our locations and you get to go use them for your Botox, your laser hair removal, your acne scars, PRP for hair, whatever anti-aging. But those dollars aren't unlocked unless you get a skin cancer check.
That's amazing. I mean, that's a huge service that you're providing because like you and I know the world of beauty, aesthetics, and medical dermatology are sort of all intersecting, right? So, you know, what some people consider purely medical, other people might consider more aesthetic. And it's really blending, right? Now, your hair has such an impact on your social well-being, right?
That's right.
So is that a medical condition or is that a beauty condition?
That's right.
Like, who are we to decide what it is?
There's nothing pretty about a 6-inch scar on your cheek or your forehead.
Of course, yeah.
Because you didn't get checked early enough, right?
And I deal with patients, you know, either have skin cancer or are undergoing cancer therapies, and they are really affected by like how things appear on their skin and how they look. If they have alopecia from chemotherapy, they want to regrow their hair. You know, if they have skin discoloration from all these treatments that they're undergoing or fibrosis from radiation, they want to improve that because it affects their daily living.
That's right.
And while some people might think that's aesthetic, it's really functional and medical for them. So I do agree. These worlds are blending, and Joya is really like coming, you know, bringing those two worlds together.
Yeah, I mean, we see this, and as you know, at Joya, we work with our psychiatrist. Dr. Shiv is amazing, right?
She's awesome, yeah.
And she sees the mental aspect of your skin, whether it's childhood acne, adult acne, whether it's hair loss. We could measure the profound impact your serotonin levels change, right? When you have a great hair day or when you have a great skin day. And so you're right. This world has, you know, your intrinsic and your extrinsic world is not two different worlds.
Yeah. I developed my skincare line in Korea, in Seoul, Korea, and I was fortunate enough to go back and forth. And you've been there too. So, you know, we see there's just more access to dermatology. People are just more willing and acceptable to go see their dermatologist on a much regular basis, whether it's for aesthetic purposes or skin health. And I think we're seeing that trend now happen in the US and, in other places abroad. Do you feel like we'll get to there someday or?
Yeah, Korea is an amazing journey to have gone through. I was part of a company called Evolus. I was very fortunate enough to be there early enough to help shape what that brand looks like today, which is called Jeuveau. Product is made in South Korea.
Nice.
I mean, talk about the beauty.
It's the mecca
right?
of, yeah.
Epicenter.
Yeah.
I thought it was France for a while,
Yeah.
but really South Koreans have done an amazing job building this ecosystem around them. Many more technologies have come out of that region. You see it today with Benev, right? Exosome plate angle there from South Korea. I mean, I could go on for days. Liquid toxins and coming out of South Korea. They're
lasers too.
Lasers, right?
Yeah.
Their accessibility is on a very different level, right? You have buildings where you migrate from one floor to the other as your case or your severity needs increases. And while you may start off as on the first floor for facials, you'll migrate to the second floor for your injectables and your lasers and ultimately your surgery. So they truly indoctrinate this. Also see it in their skin, right? Now you have wonderful skin.
Thanks,
but
Mike.
a lot of it is your line and what you use to protect it.
Yeah.
But they're born into a culture of prevention and proactive care. And
I love that.
I see that start to impact us in a really good way. I have my kids, right? They're 8 and 7. Before they run to school, they now put their Dr. Rossi skin. Luckily, I have access to it, but their Dr. Rossi sunscreen.
Yeah.
But most kids, our generation, we didn't grow up.
No, of course.
Think about
I already had
sunscreen.
a skin cancer as a kid. So
there you go.
I lived through that.
The irony of that one.
Yeah, exactly. I think it's what prompted me to, become a dermatologist because I was, always getting sunburned and that's a horrible feeling, but hopefully these kids don't have to have sunburns at all.
That's the reality of education or lack thereof. So
for sure.
To kind of tie it back to Joya, what we try to do through your lens, obviously having a dermatologist with an unbiased view of skin and skin products, right? We try to educate the mass audience out there on what you could do to prevent skin cancer, sunspots, signs of aging, hair loss. And I think that's our role in the community, having just been part of this for so long.
Yeah. I mean, I think the educational aspect is key because we're really helping empower people make informed decisions, whether it's about their skin health or even just the aesthetic procedures that they're contemplating, because there's so much noise out there now with what's the best or what's the hot and latest. So I think really getting back to basics, having people understand the different categories is just as important as them going different providers, which you're also vetting, which is amazing. Yeah.
Yeah. We'd like to make skin regimen very similar to your workout and your eating habits, right? You should be able to hear from a dermatologist, hear from a psychiatrist, what impact this has on my health, my mood, my looks, my confidence. And you should be able to engage and maintain your skin. I mean, it is an organ. It's a breathing, living organ, and it protects you from 99% of what's extrinsically right out there. So having access to vetted providers is very important to us, right? Having a dermatologist create our 14-point checklist to say, if you don't meet these criteria, we won't have you on our network is very critical to our members. And that's something we're really proud of.
I think it's super interesting, and you touched on this, was the mood aspect of your skin. And, working with our psychiatrists, it's really interesting to see how many things affect our mood on a daily basis, including your skin. And I know there's been some studies, phase 4 studies about Botox for depression. They haven't really gone all the way with that, but they did notice some trends that people in their cohorts in these clinical trials felt less depressed.
That's right.
Which is amazing. And whether that's a neurofeedback mechanism from the actual inability to make the frown muscles, or whether it's because their appearance changed, is yet to be fully determined or fully vetted. But I think what we're talking about a lot is body self-image. And I know you've been doing a lot of work with that as well. And even in the campaigns that you've launched for the products back in the day, you focused a lot on body self-image. And we're seeing that change as well. And we're becoming more inclusive, more accepting of different body types, which I think is really important for the market, right?
That's right. Let's not forget your social circle and the impact it has on your well-being. You get your Botox, and a couple days later, someone says your skin looks good.
Yeah.
Right?
Yeah.
That positive affirmation is the reason why you continue to do it. But that positive affirmation is why people walk away feeling better.
Yeah,
right?
for sure.
And I think as a community, right, people need positive affirmation around them to maintain their self-confidence. Now, we've seen this through our lenses from two different worlds. Unfortunately, because these products are not studied accordingly, the promotion or the capability for the consumer to hear about this is not magnified like it is, treat your glabellar.
Yeah.
Botox is now licensed to a third-party company, publicly traded company, to look for or to study depression rates. So we know that. We know that in the UK, a secondary endpoint behind toxin is the depression scale.
Wow.
So we know that there's a lot of work being done out there to show and quantify the mood impact of this.
Just for the audience out there, companies can't market these unless they're actually studied and FDA approved. So they actually have to go for the FDA indication before they can market it towards it, which is important, right? Because we want to tell the public what they're actually intended for. But, people use a lot of things off-label, right? And so the world of off-label cosmetics and how we're using that and how it's evolving is also super interesting, because I feel like faces are morphing nowadays.
You have the privilege as a dermatologist to pick and choose the right products for your aesthetic outcome, right? Mm-hmm. For your patients. Companies can't go there as fast as you can, right? I think Botox a couple of days ago was at ASDS, right? The American Society of Dermatological Surgeons, which is one of the biggest meetings in dermatology. Botox announced the platysmal band, right? Your neck smoothing or softening. Well, how many years have you been injecting
for sure? Off-label, we've been injecting Botox for the neck for many, many years, But it's interesting because now patients will hear about it from a consumer marketing standpoint. They'll hear about it and they'll come in asking for it. Whereas like many times when I recommended it off-label, patients are like, "Oh, I didn't even know you could use it." And so you always have dermatologists pushing the boundaries of what we can do, and then eventually the public catches up as far as marketing goes. But I think it also underscores the relationship there, right?
Between you and the industry.
I think you hit on that in Joya too, is because you have to find a good relationship. And long-term relationships, I think, are better than one-night stands, as I like to say. Those can be fun too. But for a dermatologist, you want a long-term relationship, right?
Yes.
Because they know your skin. They also know how you look aesthetically, and you can really partner with them.
Yeah, so to that point, on the Joya platform, we capture your historical procedures. And I think it's important that every consumer walks around with their health record and their skin record, right? It's not easily accessible, meaning your skin record. If I were to tell you, hey, Dr. Rossi, what did you do for your skin and hair in 2018?
I wish I knew.
Right? Or 2019 or 2020. But as you move countries, states, cities, jobs, whatnot, it'd be great for every consumer to walk around with their skin thumbprint in their hand, right? So that they could go to their doctor and say, I did get filler. Maybe that's why I have this blue line under my... Right? Your skin changes over time. Gravity has an interesting impact on your skin. And so while we might see something and chase it for a different reason, having that historical record of what you got will help every dermatologist treat, right, those patients in front of them in case those patients weren't with them over the last 10 years.
Yeah, no, I think it's so true, because patients will come in and say, I don't remember what I had. I don't remember what I took. I don't know if it worked or not. And it's when you're meeting someone for the first time, it's exactly that. You're trying to figure out their history, who they are, what's worked, what hasn't worked, and where you can go from there. So having that digital footprint is
critical.
It's amazing. Yeah. We talk a lot about prevention as well on this podcast too, and prevention in terms of skin cancer, but also preventative aging, which again, companies really can't market towards because there's no indication for it. But we do know that these small treatments over time can really help prevent these signs and symptoms of aging. I know there's been a lot of twin studies where one twin gets preventative treatments and the other twin doesn't do anything, or one twin's a smoker and the other twin's not a smoker. So you can actually see the differences, what happens from the extrinsic aging point of view. The intrinsic aging is the twin itself. It's their genetic makeup, which they share. So That's their intrinsic agent, but just the extrinsic factors, the environmental factors, these tweakments we can call them, or the lifestyle choices that they make, they really do have an impact on how they look.
True.
Yeah.
We're a big believer in prevention. As a matter of fact, that Joya's tagline is preventative skin health.
Yeah.
And I mean, first of all, happy birthday.
I
forgot to mention. So you'll always look 30, right?
Yeah.
You'll always look 35 because you were engaged with your skin, right, for so long.
Let's hope.
So happy birthday and
Thank
you. And congrats again on this platform. But we know for a fact, if you start early, right, you could prevent signs of aging. If you start early, you could prevent furthering of hair loss, right?
Yeah.
If you start early, you may not go bald, right? There's a profound impact of a healthy hair next to a dormant hair, and dormant enough to the point where you could reactivate it versus completely loss of hair and then trying to re-engage
I love it.
that.
It's like I'm speaking to another dermatologist. You're speaking my language.
I wish. Right? So the sooner people are aware, the sooner they can engage. At Joya, economically, we don't make any money whether you choose to use one product or the other. That's not what we're about, right? Our members pay us to coordinate care, to educate them, to provide them access, and ultimately lower their cost. Right? That's why we exist, and our existence is to constantly educate the consumer on what they could do for preventative measures, because it will have a lasting impact.
I always tell my patients it's easier to prevent and treat very early than like chase our tail later on, especially when it comes to hair loss. And just tell people, if they really want to know what their hair is going to do, look at their biological parents. If they have them and they can see how they sort of age, you're basically going to age like your biological parents.
And beyond hair, right?
Yeah,
I mean,
exactly.
If you look at facial atrophy, if you look at, do you come from a descendant of people that tend to sag or wrinkle, right? Do they have severe tear troughs, right? So looking at your parents is a big indicator of what you could chase earlier on. Than to correct. I think the team has a great saying at Joya that prevention is better than the cure, right? Because by the time you go to cure this thing or whatever thing it is, it becomes costly, and then people tend to look a little odd at that point as well.
You never want to sort of do everything all at once, right? Why do so many celebrities do that sometimes? It still boggles my mind, like why people all of a sudden wake up one day and just decide to do everything all at once. Right? It's like really drastic. It's so noticeable. Yeah. It's the ones that do little things over time that you never really can tell the change, right?
And from a wallet effect, you kind of want to do that.
Yeah.
Right? People tend to want transformation at the time of their age where they could afford it. Right? But the purpose behind Joya was to give affordability to a wide range of people so that more people can feel better in their own skin. So the idea of spending, call it $1,000 a year for skin maintenance, some Botox, a little bit of laser, and some good skincare product will have such a profound impact in your 30s and your 40s and your 50s if you start sooner. Yeah. But these celebrities, they hear about a couple of things and they go rush at it. They throw all this money at once, and then they try to set the standard or the trend of what people should do. The reality is most people can't afford to do all this at once.
Totally, yeah, exactly.
So they shouldn't.
Yeah, and I think it actually looks better when done in smaller increments
subtly,
than all at once. Because sort of the skin has to react. It has to settle. It has to change. And I think that's what also I try to educate my patients on, is that doing one thing is not necessarily going to fix everything, right? It's doing little things in microdoses or pieces that make the whole puzzle look better, right?
So what can we tell our audience here today? If you were to do 3 things over the course of the year?
I would get a good relationship with a dermatologist or an aesthetic provider, right? Okay. Set a baseline, get an intake. What do you care about the most, right? Or what are the top 3 things that, you're concerned about? Okay. And then from there, get on a good plan and do things in quarters. I think that's easy for people, right? Every quarter, just sort of try to tackle something or just check in. And of course, get a skin check at first.
And for procedures, what do you recommend?
Yeah, so I think it's really important to customize, right? Again, This is not like, we're not trying to be a cookie cutter, one size fits all. I think it's really important. I think some people come in and they say they want Botox or they say they want filler, and they're not really sure actually what they need, you know? And so seeing their face in animation is important, and understanding what they're looking try to achieve. And of course, for me, sunscreen is always like number one,
That's right.
Prevention. We know UV causes aging and it also causes skin cancer. So making sure they're doing good habits every day is really important for me, because changing people's habits is really hard.
That's very.
As a doctor, I realize like it's very hard to change people's baseline habits.
I agree.
And even in relationships, it's hard to change your partner's habits. So it's really important to understand that. But these subtle changes every day can really help build up over time.
I agree.
I love prevention. I think about lasers as prevention. I think about small amounts of Botox as prevention, because it does help prevent these lines from actually etching in. Again, it's not marketed because they didn't study that, but we know that over time it helps prevent these like etched in lines. And of course, I love preventative lasers. I use lasers not only for wrinkles, but also preventing skin cancer. We have really good studies now that lasers like the ablative CO2 laser or the non-ablative Fraxel laser, Fraxel is a brand name of a thulium laser, they can actually help decrease your risk of skin cancer going forward. And I know you also educate on that.
Yeah. There's two things that I've learned that people don't realize. Number one, that lasers have this dual impact
for sure
on anti-aging and prevention of skin cancer. So that was a big one. And the other one, interesting enough, most people don't realize that dermatologists treat hair.
Yeah, exactly.
And so as we built this Joya platform, I'd say 39 to 40% of our audience are male. And so when I look into why they joined, it's usually hair thinning, hair loss, or acne scars. And when we ask about why now, we usually hear, we didn't realize that you could do anything about this and that dermatologists can treat it.
Yeah.
And then on the flip side of it, to this regimen, the idea of a laser that could potentially kill a dormant skin cancer cell before it becomes skin cancer is very appealing. And I don't think people know that.
Yeah. I mean, it's not that, that research has been done for quite some time. So it's not like it's new in the research front, but it's new for getting it out there to the public, which is great. And I applaud people. My old fellow did the study on that, and he published that, which was amazing. It got a lot of news coverage, but it's something that we've known for a while. It's just, it's great that the public can also understand that. Yeah.
Yeah, but that's a perfect case of the industry can't scream, right, that to the public. And so therefore you need podcasts like this. You need a platform like Joya. You need someone else in line with a dermatologist to scale that noise.
Yeah. Are you a supplement guy or no?
I try to be, especially for hair.
Yeah.
So I do like hair supplements for preventative measures. I do like skin supplements, but I should be better at it because I hear about resveratrol and NAD and all these anti-inflammatory, anti-aging supplements. I just, the compliance is a problem for me.
Yeah, for sure. Compliance is, for anyone, it's hard.
I'd rather get a shot and be done with
it. We get into that too, as, supplements, and we talk about that on the podcast, but it's really, compliance is key with anything. Same thing as like going to the gym. Like, if you don't go to the gym every day, it's hard to see change.
That's right.
So, of course, everyone wants a magic pill, but I do think there are certain supplements that will help with skin health and also hair, depending on if you're in an imbalance or not. And again, this is something you can talk to your provider about.
I'd rather take a gummy than a pill.
Yeah.
So I kind of look at supplements as my dessert now.
Nice. That's good. Yeah.
If it comes in the form of a gummy, I'll do it because I feel like it satisfies my sweet tooth.
Yeah.
And I feel like I'm doing something good for myself. But the idea of just swallowing 4, 5, 6 pills a day, it's a lot. Yeah. It's a lot.
I know. I mean, we're in such a great time to be alive because like we have all this science, and then like we have the industries that help sort of like create this science and make it accessible.
Yeah.
So I think we're in a major point in time, but it's also important that we cut through a lot of the BS that's out there.
What supplements do you take?
I take nicotinamide every day.
Okay.
It's been shown, it's a form of vitamin B3. It's been shown to help cut down precancers and superficial skin cancers.
Oh, gotcha.
In certain in immunocompetent populations.
So you do it for skin cancer purposes?
Yeah.
And
But
then
there is some anti-inflammatory effect as well.
do you take other supplements outside of that?
Yeah, I mean, I take a whole host of supplements, but I work out a lot. So
Yeah.
I take magnesium to supplement. I think
Okay.
it's really helpful, especially for muscles. You might lose magnesium in sweat. So there's some just essential things. Most of these things you can get from a really well-balanced diet.
Oh, good to know.
But it's hard when you're working all day or
On the go.
on the go. You'd love to sit down and like have like perfectly portioned, well-balanced meals,
hard.
but it's hard. Yeah.
Very hard. Very hard.
And like it's, we have to find the time to do better.
I'm an investor in a company called Epicured.
Oh, nice. Tell us about it.
Yeah, so Epicured, it's interesting because they have Michelin star chefs developing meals as a cure for cancer patients.
Oh, wow.
They're a big believer in your food being a driver of your healing process. And met the team, loved the team, but I really appreciated the mission. My Middle Eastern background rooted in me. Food is a big driver of the culture.
For sure.
And healthy food is a very different experience, right? And what goes into our food system here, I mean, if you really want to go down a different podcast and a rabbit hole, oh man, you wonder why Italians eat all the bread in the world and they look amazing and fit, and yet we could have a fraction of what they consume and be pre-diabetic very soon.
Yeah.
But so this company was driven off this mission that they partner with hospitals, large oncology centers, and they introduce food as part of their medicinal process.
That's amazing.
And they've have shown profound impact. So
yeah, it's like getting chicken soup when you're sick as a kid. Yeah. Like it's soothing, but it also has a lot of nutrients.
That's right.
That whole concept is really true. And
That's right.
Unfortunately, I think because our world is so fast-paced and we're so on the go, our food choices have like been really poor. So that's amazing to hear.
Yeah, and what better way to quiet inflammation down than to have anti-inflammatory intake? Talk about compliance. We can't take a pill a day, right? Or a vitamin or whatever, but we have to eat every day.
Yeah, totally.
So if that food had better properties and was much more anti-inflammatory in nature, I kind of just stopped milk and yogurt for my kids because of its inflammatory component, and I substitute their calcium elsewhere.
Yeah.
So I'm a believer in it, but I'm sure I could always do better.
Well, one thing I read that's interesting is Gen Z themselves are drinking much less alcohol.
Yeah.
Which is really interesting. They really understood, that alcohol has been one of those contributors to disease, poor health.
Aging,
exactly.
Yeah.
And,
it's funny. I talk to my wife all the time. She doesn't drink.
Yeah.
And so.
And she looks amazing.
She looks great, right?
Yeah.
And so I ask her, why don't you drink? Her number one answer is it ages you.
Yeah, exactly.
It accelerates your aging process. Why would I want to do that?
Yeah, totally.
So I'm like, well, that's kind of a
that
boring
wasn't
way.
around when we were kids. Yeah.
Like, sounds like a boring way to go through life.
Yeah.
But she's right.
Yeah.
She's right.
And I say so many of my patients ask, should I quit alcohol altogether? And I was like, well, of course, if it's a personal choice, if you want to, yes, it makes you feel better, of course. But, things in moderation is also, healthy. Like, a glass of wine, one is okay, a whole bottle, probably not.
Probably not.
Yeah.
So, it's not as much fun though.
No, I know. Yeah. So it's all about moderation. Yeah. No, but that's amazing. You have so many different aspects, but they all sort of fall under the same umbrella.
Intertwined.
Yeah.
I just, the mission behind everything I do, whether it's an investment or I love building. So I really enjoy the building process. If it could give people the feeling of, I like to say, like, I want people to have the feeling of good skin. Right?
Yeah.
It's kind of like giving good face.
Yeah.
Right? That's a feeling-driven statement.
Totally.
Right? And so if there's anything that I could contribute to this market or kind of my journey here, when it's all said and done and you close the book and say what you're most proud of, if we could give access to everyone to feel what good skin feels like, I'd say it would have been a worthwhile journey.
I agree. So how do people sign up for Joya?
Good question. So ask your employer about it, right, is your best bet. We've been in the market for a couple of years. So most likely our audience won't have access to it, right, through their employer, which means going on our website and just contacting us and letting us know who your employer is would be a great way for us to give you access. And then in a few months, depending on when this podcast airs, we'll have, at a slightly higher price point, we'll have a direct-to-consumer access. So just put your name on our list and we'll give you access to it here in a few months.
That's very cool.
Yeah.
Congratulations.
Thank you again.
Thanks.
Great to be here and really appreciate you and what you're doing for the world of skin.
Yeah. And I'll get in touch with you if we have questions from the audience, and
please,
feel free, to
give
answer.
Give him my cell phone, give him my email, whatever works.
I don't know. I mean, he knows a lot, everyone. Yeah.
Happy to help.
Thanks, Mike.
Thank you for having us.
Great.
Thank you.
Whether you're a skincare enthusiast or just looking to improve your skin health, you'll learn the science behind radiant, healthy skin. I'm Dr. Anthony Rossi, double board certified dermatologist and founder of Dr. Rossi DERM MD. Subscribe to Give Good Face on Apple Podcasts, Spotify, YouTube, or wherever you stream your podcasts, and stay connected with me on social media at Dr. Anthony Rossi and at Rossi DERM MD.